If you've ever had chronic low back pain, you know it is so much more than just an ache. It can be completely debilitating. And what's really frustrating is that finding a treatment that actually works and lasts can feel impossible. Well, today we're diving into a really fascinating study that offers a new ray of hope, a non-invasive one for a super common type of back pain. So let's get into it.
So, where does so much of this stubborn pain even come from? We always hear about big muscles or herniated discs. But a lot of the time, the real culprit is a set of tiny little joints in your spine that are just notoriously hard to treat.
In fact, get this. Research shows that nearly a third, 31%, of all chronic low back pain starts right in these little structures. They're called facet joints. So what are they exactly? The easiest way to think of them is like the small knuckles of your spine. They're there to guide movement and keep you stable. But when they get inflamed or arthritic, even simple things like leaning back or twisting can set off this intense, sharp pain that can radiate into your buttocks and down your thigh. For a long time, the go-to treatments have been, well, pretty intense. Doctors can go in with a needle and inject steroids right into the joint. Or they can do a procedure called a neurotomy, where they literally burn the nerves that are sending those pain signals to your brain. And yeah, these can help, but they also come with some serious risks. We're talking infection, bleeding, even nerve damage. So you can see why everyone's been looking for a safer, non-invasive alternative. And that brings us to the core of this whole thing, a clinical trial that tested a completely different idea, an approach that doesn't use a single needle or scalpel. It's called Extracorporeal Shockwave Therapy, or ESWT for short. Now, that sounds complicated, but extracorporeal just means outside the body. It's actually based on the same technology used for decades to break up kidney stones. The idea is to use a device to send high-energy, focused sound waves deep into your tissue, right to the inflamed joint, to kickstart the healing process and reduce pain, all without ever breaking the skin. Of course, with a technology like this, precision is everything. I mean, these facet joints are tiny targets, so to make sure they hit the exact right spot, the researchers used ultrasound to guide the applicator in real time. It's like having a GPS for those healing sound waves. Now, to really prove this works, you need a rock-solid scientific study. So that's what they did. They got 128 patients who all had confirmed facet joint pain. Then they randomly split them into two groups. Half of them got the real shockwave therapy, the other half got a sham or placebo treatment. It looked and sounded the same but didn't deliver any real energy. Then they just sat back and tracked everyone for a full year to see who actually got better. So after all that, what did they find? Well, the results were frankly pretty incredible, and they suggested something much more than just a temporary fix. Okay, here's the headline number. The patients who got the real shockwave therapy reported on average a 64.4% reduction in their pain after 1 year. That is a massive, life-changing improvement that actually stuck around long after the treatments were over. And this chart just lays it all out perfectly. See the white boxes? That's the group that got the real treatment. Their pain scores drop way down, and crucially, they stay down for the entire year. Now look at the gray boxes, the placebo group. You see a little dip at the beginning, that's the placebo effect, but then their pain just comes right back. This is pretty clear proof that the shockwave effect was real and lasting. But it gets even better. See, the researchers didn't just ask the patients how they felt. They actually looked under the hood with MRIs. And what they found was that in nearly 60% of the patients who got the real therapy, the actual physical signs of inflammation on their scans had vanished a year later. And this is really the key. The changes weren't just something patients felt. They were something doctors could see. Look here. The image on top labeled pre shows that bright white spot. That's inflammation in the bone, something called bone marrow edema. Now look at the post image on the bottom. It's gone. This suggests the shockwaves weren't just masking pain, they seem to have actually helped heal the underlying problem. Now, whenever you get results this good in science, you know it's going to attract a lot of attention. And that means it's going to be put under the microscope. So let's look at how the rest of the scientific community reacted. It's the big question on everyone's mind, right? Is this the miracle cure we've all been hoping for? Well, as with any big finding, other scientists immediately started asking some really tough but really important questions. In fact, a follow-up commentary in the same journal called the study a significant advancement, which is high praise. But it also raised some key points for future research. And this isn't about tearing down the original study. This is how science works. You build on new discoveries to make them even better. So, what were these questions? Well, first, this study was really picky about its patients. So, would this work on more typical patients who might have other back issues going on? Second, how did they make sure the targeting was perfect across 5 different sessions? Third, and this is a big one, could patients tell if they were getting the real thing or the placebo? Then, does this kind of inflammation ever just go away on its own? And finally, how does this really stack up against the current gold standard treatment, nerve burning, in the long run? And that third question, about patients knowing which group they were in, turned out to be a real issue. Get this. A whopping 95% of people in the real treatment group correctly guessed they were getting it, probably because they could feel the shockwaves. When people know they're getting a real treatment, it can really influence how much pain they report. Now, it doesn't change the objective MRI results, but it could mean the pain relief scores were a little inflated. So, where does that all leave us? You've got this incredible study with amazing results on one hand and a really thoughtful scientific critique on the other. Putting them both together actually gives us a really clear picture of what needs to happen next. Even with all their tough questions, the scientists who wrote the commentary were crystal clear on one thing. They said, this study represents a significant advancement in the field of non-invasive spinal pain management. So there's no doubt this is a huge step forward. The big takeaway here is really one of cautious optimism. Shockwave therapy seems to be a super promising, non-invasive option that doesn't just reduce pain, but can actually show visible signs of healing. But we're not at the finish line yet. More research has to be done to figure out exactly which patients will benefit the most and to really compare it head-to-head with the more invasive treatments we already have. And that leaves us with a really cool thought to end on. We could be moving from an era of invasive needles and burning nerves to one where we can harness the power of focused sound waves to heal the body from the outside in. There are still questions to answer, for sure, but this study suggests we might be on the edge of a whole new way of treating one of the oldest and most common problems in medicine.